1/2 of all working Americans admit to having back pain symptoms each year. With the frequency of back pain, many are in search of some treatment.
Absolutely. Dr. Nuala Crotty from Spectrum Health Medical Group in the Spine and Management Center joins us today to dispel a common myth. Now, Nuala, thank you for being on the show.
You're welcome. Glad to be here.
I am one who has been down this road 2 or 3 times where I feel like I am immobilized. It's from something as simple as just reaching up for something from a high shelf to actually doing some yard work. I mean, my back has given me over the years, now and then, decided to give me some trouble. And what I've always done is ice, heat, and stay still. And
but that's not the case, right?
Move around.
Well, actually, in the first few days following an injury, taking some relative rest can be helpful.
Okay.
So doing what we call activity as tolerated. But if you're 4 weeks out and you're still not doing your usual activities, then that's a concern. And people often do that because they're afraid of making the injury worse.
Sure.
Or they're afraid of the pain they'll feel if they become more active.
That's exactly right.
But kinesiophobia, which is the medical term for fear of movement, is one of the biggest risk factors for developing chronic pain, which is pain that doesn't go away.
Okay, okay.
So my advice typically to my patients is to be as active as you can within your pain tolerance. And if you're still having pain about 4 weeks out, then go see someone who's going to help you relieve it and get you back to your normal activities.
Okay. And you guys do take some really unique approaches to helping out patients, correct?
Yes. So we're a comprehensive interdisciplinary spine center, and comprehensive in the sense that there are 4 different specialties represented in the clinic. There are pain management specialists whose focus is primarily on pain medicine, pain medications, I should say, and injections. And then there are physical medicine rehab specialists like myself and my colleagues who do non-operative spine care. We also have pain psychologists who help people with the psychological effects of pain. And then we have surgeons who can do surgery if you need that to treat your back pain.
Okay.
So no matter what type of pain you're dealing with, sounds like it's pretty comprehensive what you're going with, that you can handle.
And you want people to be very honest with you too. That's the time to really let it out there as far as your extent of pain, you know, that sort of thing as well.
Absolutely, because then we can help them better.
Absolutely.
You know, we are a designated spine center of excellence as well within Michigan.
Oh,
and that designation is not exactly easy to get.
No, and the reason we got it is because we are a comprehensive spine center, and we also have what's called an interdisciplinary program, which means that we meet not only can you see different providers within the clinic, but that we meet on a regular basis, a weekly basis, actually to discuss the more complex spine patients.
Okay.
So we can treat anything from kind of generic garden variety low back pain to the more complex spine and other pain conditions.
All right.
And I think more than just what we do, more than the expertise, the knowledge expertise and the technical expertise, I think one of the things we do well too is we place a real emphasis on our relationships with our patients. So anywhere from the people that check you in, through the support staff, through the providers, we really try to respect our patients, partner with them, and really listen to them in terms of what's going on with their pain. You know, I think the healing process is about what you do to the patients, but also about how you care to the patients.
Sure.
And so we try and build in that relationship piece into our care for our patients.
So kind of a traditional visit maybe, or if there is such a thing, because everybody's condition is different, I guess walk people through what they'd experience from the time they walk in the door. Maybe you sit down and just kind of have a conversation and move on from that point, right?
So you'd sit down, you have a conversation, you tell your history about the pain. The specialist you'd see would do a comprehensive exam, and then they would pull up any imaging studies you might have, like an MRI or an X-ray, and then discuss with you what they think is causing their condition. They would partner with you then in coming up with a treatment plan that works for you, because everybody's different. Everybody has different needs.
Right.
If they feel they need the input of another provider within the clinic, they'd refer them on. Or if they feel your condition is very complex, then they would bring them to that weekly team meeting where they get input from all the different providers.
Now, coming to this clinic, is this a first step, or is this something after seeing your family physician?
You know, it can be either. A lot of primary care providers, if it's generic garden variety back pain, can take care of you. But if your pain is persisting at the 4 to 6 week mark, we want to see you.
Right.
Because there's a lot of research out there to state that if you've got pain at 6 weeks, then your risk of having persistent pain that doesn't go away is high. And that can be difficult to deal with day in and day out. So we want to see you early on so we can treat you and relieve your symptoms and get you moving again.
Great. All right, some great advice.
So that myth of after 6 weeks staying still can actually create a problem. The
actually create a problem.
All right,
Yes.
very interesting. All right. Thanks so much for your input.
Thank you.
Sure. The center is located at 1900 Welty Street Southeast, Suite 290. You can call them at 616-774-8345 or just go online to shmg.org/spine. And